You're watching The Source on CNN Philippines. Our source today, Health Officer in Charge Maria Rosario Vergeire. Yusek, as usual, maraming salamat po sa inyong oras. Let me start. There's a lot to talk about monkeypox. What we know so far, at least last Friday, is that the country recorded its first monkeypox case. And it's a 31-year-old Filipino. We don't know male or female, who arrived last July 19. And this particular individual had 10 close contacts. First, Yusek, how is that person doing?
Well, the individual, the one afflicted by monkeypox, is doing well. He is on to his recovery stage already.
Okay.
The other symptoms have subsided and the lesions are getting healed already.
And then the number of, so it's a he, the number of close contacts was at 10. How are they?
Yes, all of them are asymptomatic as of this time. We are closely monitoring them every day so that we will know if there would be any symptoms at all. But until this morning, there are still no symptoms and they will just continue their quarantine period.
But how many days has it been since their contact with the infected individuals? Hence, I guess I want to know how many days does it take before symptoms actually appear?
There is this incubation period for this disease. It's 5 to 21 days. So it's not going to be the same for everybody. So the best thing that we will do right now is to complete these 21 days of observation among all of these close contacts.
So you could have no symptoms, Yusek, for the next 10 days and get it on the 12th, 13th. So it means you're not safe up until, I don't know, I guess 21 days of the incubation period?
Well, just to be sure, we're going to do that so that we will be able to be sure that the transmission will not be forwarded to anybody else, because this is the incubation period of the virus within each individual.
3 weeks, okay. Any updates on any more confirmed cases? Are there suspected cases right now with the RITM?
We were able to test alongside with this individual afflicted with the monkeypox and other 25 samples coming from other regions, and all of them turned negative already. These were cases of varicella and the other viral exanthems, or those that with lesions, but all of them were negative. So this is the only one that we have right now. But we are continuously monitoring and doing our surveillance.
Yusek, when you turn out negative during an RT-PCR, is there a need to do a confirmatory 1 day later? I guess what I'm trying to say, is there a point na baka masyado pang maaga na nag-test ka for monkeypox kaya it turned out negative?
These individuals, because monkeypox illness, as soon as you have your symptoms, you're already infectious. So when you have symptoms, that's the time that the samples are collected as well. So if you get this during this time, your samples or your test results will be accurate. So no need for repeat testing just to confirm, because this is already confirmatory.
But you're saying you have to have symptoms for the tests to be accurate.
Yes, we don't test those without symptoms. They will only seek care when they have developed maybe fever or the lymphadenopathy, and some of these people will have the lesions already. That's why they go to seek care.
Okay.
That's why they are tested, and these are the ones that we have tested already.
Sorry, just to be clear, those 10 close contacts, were they tested?
No, they were not.
Okay.
They do not have symptoms at all. They are just being quarantined and monitored.
So, itetest ka lang talaga kapag meron ka ng symptoms or meron ka mga lesions or may fever and other symptoms. Okay, so let's clear up any confusion, Yusek, on this. So, monkeypox is a virus that can infect anybody, from my understanding, through close contact and even items that are deemed contaminated. So, siguro explain po natin kung kaya sa Tagalog, paano ho ba ito natatransmit?
Yes, ito pong sakit na ito, itong monkeypox, is transmitted by direct contact. When you say direct contact, maaari nyo pong makuha ito. Halimbawa, nakihalubilo kayo sa mga taong may monkeypox, tas may mga lesion po siya, madikit kayo doon sa taong yon, makukuha nyo po ang sakit. Maaari nyo po rin makuha ito through secretions of the body. Kaya ngayon po napapabalita that 95% is transmitted through sexual contact. Dahil nga po dun sa secretion, maaari po nating makuha yan. Ang isa pa hong pwede natin pagkuhanan ay yung fomites na tinatawag. Halimbawa po yung mga beddings, yung mga damit po ng taong may monkeypox, maaari nyo pong makuha yan through that kapag po nahawakan nyo o kaya ay naidikit sa katawan nyo. Meron din po tayong droplet infection na tinatawag for monkeypox kung saan kapag may close contact talaga with another person, tapos nag-kiss kayo o di kaya ay nagkalapit ang inyong muka at siya po ay medyo nabahin o kaya ay naubo, maaari niyo po rin makuha ang sakit na ito. Kaya yun pong ating mga preventive measures for COVID-19 also works for this monkeypox virus.
So it's clear, no? It's not just obviously through sexual intercourse. Kapag mayroon pong lesion na sinasabi ninyo, nagkatabi po tayo, pwede ko pong makuha yon. And then even, I think more important, Yusek, yung sinabi nyo, kapag beso-beso, pwede din yun. Basta't, sorry, kailan ho ba meron na po siya mga lesions, meron na po siya yung mga butlig-butlig, ganun ho ba ibig sabihin nun?
Hindi po. Katulad po ng sabi natin, ang sakit po na ito ay magiging infectious o nakakahawa na po ang tao kapag kayo ay may simptomas na. Bukod po sa lesion, you can have fever before these lesions happen o lumabas sa katawan nyo. So maaari kayo magkaroon ng lagnat, maaari magkaroon ng kulani, the lymph nodes that you feel here under your ears. Opo, maaari po yun. Maaari po pananakit ng katawan. So ito po ay mga bahagi ng simptomas. Kapag meron kayong ganyan, kahit wala pang lesion, maaari na rin po kayong makapanghawa sa ibang tao.
I see. So, hindi kailangan hintayin yung nakikita po natin dun sa mga pictures na meron na pong signs yan po ng monkeypox. Yung pag meron na pong kulani, meron ka ng sakit, may fever ka na, infectious ka na at that particular time. So, what should one do, Yusek, when suspecting of monkeypox? Sabihin po natin...
Yes, ma'am. No?
Go ahead, Yusek.
Sorry. Yes, ma'am. What would be most important right now for everybody is to seek early care. Kapag kayo po ay nilalagnat, kahit na wala po yung kulani o yung lesion pa, pumunta lang sa ating mga health center. Libre naman po yan. We have already oriented all of our healthcare workers and facilities on how to detect this so that you can be observed also. Early care is best po. And of course, pangalawa, yung preventive measures natin, ang laging pag-uugas ng kamay, ang lagi po tayong vigilant, dapat tayo mapagmatyag. Dapat alam po natin kung paano maiiwasan at kung ano yung mga simptomas ng sakit na ito.
So kapag magpa-test po, pag meron ka ng simptomas, lagnat, etc., magpa-test, is it the same test that is used for COVID? And is the procedure the same?
Well, it's different actually. No? It's RT-PCR, yes, it's plate-based. Pero ang ginagamit po dito kasi, yun pong RT-PCR, may kit po para sa monkeypox. So nakagawa pong RITM para dyan. Tapos kinukuha na natin po syempre ng samples, yung mga lesions din nila, no? Aside from the other area. So ito po ang ating ginagawa. Dito po sa COVID-19, talagang yung sa ilong at saka sa bibig po ang ginagamit na.
Opo. So kapag may lesions na po, doon kukuha. Paano pag sakit pa lang po, fever pa lang?
Opo, nakakakuha rin naman po ng samples, no, while like you have fever also.
Through the nose and the mouth?
Yes, ma'am, sa ilong po.
Sa ilong. Okay. There's also concern, Undersecretary, do we have enough RT-PCR tests for the monkeypox virus?
Yes, ma'am. We are very capable of detecting this virus. We have that capacity of testing 1,000 samples per day through our ITM.
Okay, 1,000 samples a day. And it's still just our ITM, no, that can test for monkeypox?
Yes, ma'am. Pero ngayon po, kinakapacitate na natin yung subnational laboratories po natin sa ibang regions natin para po lahat po ay magkaroon, yung access po will be improved. Okay.
We understand, of course, that over 70 countries have reported cases of monkeypox. Yusek, in terms of vaccine, I know that we don't have anything yet here because we need a permit from the FDA. Pero abroad po muna tayo. I was doing some reading on this. Are there two vaccines that are possibly available for monkeypox?
Well, there are vaccines available actually, ma'am. And these are vaccines which were repurposed. These vaccines are the vaccines that were used for the smallpox. Nirepurpose po ngayon sa US at binigyan po ng clearance or permit ng kanilang Food and Drug Administration that can be used for monkeypox. unfortunately, the supplies are really limited. At kakaunting bansa pa lang po ang nakaka-access nito. So we are now exploring our discussions and negotiations with our development partners para matulungan tayo if we can access this vaccine for our people.
So no direct vaccine for monkeypox, but parang tinatawag po itong smallpox, parang off-label. Yung smallpox, pwede pong vaccine ang pwedeng gamitin sa monkeypox. Any other vaccines that is being currently used aside from the smallpox vaccine?
None that we know so far. It's only this smallpox vaccine that we repurposed for the monkeypox. But let me just remind our people that this monkeypox is not like COVID-19, that we need to vaccinate all Filipinos so that we can prevent further transmission. Ang monkeypox po, may specific sectors lang tayo which we identify as people that should need this kind of vaccines, like our healthcare workers and the other vulnerable sectors.
So that's what I wanted to ask, because that's also what I read. It's not for everybody, this particular vaccine. So nawala po kayo, there was a part na wala kayo, Yusek, no, pasensya na po. So the candidates would be healthcare workers and who else? Senior citizens, comorbidities?
Those who are vulnerable to this disease. So we would like to identify high-risk individuals who can receive these vaccines. Kasi ito pong bakunang ito, binibigay ito pre-exposure at post-exposure. So yun po mga high-risk individuals like our healthcare workers and those sectors who are really vulnerable to this disease.
Okay. And siguro yung tanong na po, how soon must we get a special permit? I know that you're saying there's a problem with the supply. I think also in New York, it's already a health emergency, and they're also trying to get more vaccines as possible. But it's also important, just in case we get our hands on it, that the FDA already issues a special permit on this. Is this being worked on?
Yes, ma'am. No? So pinag-explore na po din natin ng Food and Drug Administration actually kung meron ngang any manufacturer at all. And napunta nga po dahil dun sa punto na kailangan natin talaga.
Okay, we're losing
ang tulong ng ating development partner so that we can be able to access these vaccines. And our yes, ma'am, I'd like to remind our people that while we await for these vaccines, this is not the only way that we can prevent this to happen. Let's just do our preventive measures and let us stay to be vigilant so that we can prevent transmission of disease to other areas of the country.
Okay, we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Health Officer in Charge, Maria Rosario Vergeire. I'm going to ask that question I asked off-air, Yusek, kasi may nagtatanong po, sabi, kapag na-vaccinate ka na ng smallpox in the past, you're safe, kumbaga, or you don't need to be vaccinated again. Is this true?
Well, we are consulting with our experts on this, especially our vaccinologists and our other experts. Pero pag tinignan nyo po, in principle, dahil nga po itong smallpox vaccine na ginagamit sa monkeypox, maaari po na may katotohanan yan. But of course, I would like to give accurate information to people. So let us try to consult our experts first, and then we will give information.
All right. Thanks for that. COVID, over 4,100 cases yesterday, I believe, one-third of that coming from NCR. Positivity rate is about 16.4, 16.5%. So we talked about this, and you talked about this with other media personalities as well. The number is increasing. There is an uptick, but how do you assess the increase the country is recording? I ask you that because you gave us numbers before, and if we were to go back to that, parang hindi tayo umabot dun sa worst case scenario kasi the number that was given was kung magpabaya tayo sa minimum health standards at hindi po ma-accelerate ang ating booster shot. So again, the question is, how do you assess the increase in the country with this particular uptick?
Unang-una, the cases are really increasing, continuously increasing. Though we were not able to reach that updated projections that we've had before, nakita naman po natin that we are trying to improve on our vaccinations at saka yung mga tao, mas aware sila ngayon kasi tumataas ang kaso. So they are really following minimum public health standards. Our updated projections would always be reliant on the assumptions that we make. That would be if minimum public health standards continue to be reduced, for yung compliance, kung magtutuloy-tuloy po na mababa ang antas ng pagbabakuna, at saka kung magtutuloy-tuloy syempre yung pag-transmit ng mabilis nitong BA.5. And what we are seeing right now, though the cases are continuously increasing, we are seeing that the severe and critical cases is still on the plateau and hospital admissions are less than 50%.
Okay, but NCR, the whole of Philippines is still at low risk, but NCR is already at moderate risk. How's the healthcare utilization in NCR, Yusek?
Well, in NCR, we can see that nasa moderate risk case classification. Ibig sabihin po, yung average daily attack rate nila ay lumakpas na po dun sa 6 na threshold natin. They are now more than 6. So ngayon, moderate risk. Pero pag tinignan po natin sa kabuuan ng NCR, yung kanila pong mga ospital is still less than 50%. Although, meron po tayo mga areas sa NCR na binabantayan natin sa ngayon dahil meron pong pagkapuno ng kanilang mga ospital. Katulad po dito sa Malabon. Pero kailangan mabigyan natin ng pagpapaliwanag. Ang Malabon po, meron lang silang 3 o 4 na ICU beds. And all of this had been occupied already. That's why it's 100%.
Right.
Meron din naman ho tayo sa ibang areas dito sa Metro Manila, katulad po ng Makati, no? Na medyo mataas po ang kanilang COVID ward admissions. Kasi po ang Makati, nandyan po yung malalaking ospital natin na pinupuntahan po talaga ng ating mga kababayan. But upon checking, ang atin pong mga admissions are mostly mild and asymptomatic who have other conditions. Kaya po sila nasa ospital.
Kaya siguro pumilit na rin silang pumunta sa ospital because they probably have some underlying conditions as well. Okay, let's talk about boosters. So, okay, now it's available. The second booster shot is available. 50 and above, 18 to 49 with comorbidities. First, punta muna tayo dun sa first booster and then sa second booster. Kailangan po ma-accelerate kasi yung first booster shots. Where are we in terms of the first booster shots?
For the first booster shots, we are just about 21% of the eligible population. For this first 100 days campaign of this current administration, we need to be able to cover or vaccinate about 23 million individuals. And during our last campaign, this campaign last week, we only had 185,000. So we are asking all of our partners, all of our local governments, mas pag-igtingin pa po natin para mas mapataas natin because our daily target is about 397,000.
That's right.
So that we can achieve 23 million by the 100th day of the President.
Yeah, we were averaging it at 400,000. So medyo mababa pa rin po, Yusek, yung first booster.
Yes, ma'am. No? So, kailangan lamang po talaga tuloy-tuloy po ang ating kampanya. We understand kasi kakaumpisa pa lang naman po nung kampanya. Hopefully, mag-pick up tayo this coming weeks. And I've heard that the President will be helping us going around the different areas of the country.
Okay, that's good. Dengue cases, could you give us an update, Yusek, please?
Yes, we have a cumulative total of about 73,000 cases of dengue in the Philippines starting January. But what would be most important to note would be around 25% of these cases happened from middle of June until this current time. So pag tinignan po natin talaga, because it's the rainy season, tumataas talaga ang mga kaso. We have 16 out of 17 regions na talagang continuously increasing po ang dengue. So we are now working with different local governments. Tayo po ay nakikipag-coordinate para po mamobilize natin ang ating preventive measures in our communities.
All right. Just one last quick topic. Ito pong yung nangyaring earthquake. I have it here that there are about 60 health facilities that was damaged by the quake. What is being done here? At ano ba yung pinakamatinding na pinsala?
Yes, we have a total of actually 177 health facilities that were affected by the earthquake. Ito pong mga facilities na ito comprises of different RHUs, barangay health stations, meron po mga city health office, municipal health offices. Ang badly affected po talaga ay yung sa Abra, yung ating Abra Provincial Hospital, kung saan madaling naman namin napuntahan ang area na ito. Nakapag-set up po tayo dito ng mga tents. Tayo po ay nag-deploy ng mga equipments para po dito sa hospital na to, pati po yung ating Philippine Medical Emergency Team comprised of specialists from our different government hospitals ay naandun na po gumagawa na po ng mga operasyon at kung ano pa ho para po wala tayong disruption ng ating mga serbisyo para po sa ating kababayan dyan. Tuloy-tuloy po nating imo-monitor. We are going to go around this damaged facility so that we can see how we can be able to assist para po maggawa na ng repairs at magamit namin po. Although they are functional, but we need to restructure or we need to ensure na safe po ito para sa ating mga pasyente.
Health Officer in Charge, Maria Rosario Vergeire, Yusek, maraming salamat po sa inyong oras.
Maraming salamat po.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.